I hope everyone enjoyed SCAI 2021 virtual. I think the program committee did an amazing job. But I also say, I wish we'd all been together. Clearly one of the professional joys of my life is spending time with my colleagues and friends in person as we go both personally and professionally together. And so I am, first of all, delighted to report that in 2021, we will be in person. So first, the SCAI Fellows meeting in Miami in December is an important one. And I think number two, SCAI 2022 in Atlanta in May. And I'm sure that SCAI 2022 will be the biggest and best that we have had yet. So I am deeply honored and privileged. I can't tell you how much to be honored to have this opportunity to represent you as president of the Society of Cardiovascular Angiography Intervention. SCAI has played an integral part of my life for over 25 years, and it's impacted my career in too many ways to count. Over the last 3 years on the executive committee, I have learned so much from past presidents, Kirk Garrett, David Cox, Shami Mahmood, and the current executive team, including Sunil Rao, George Dangus, Arnold Cito, and Peter Duffy. And more importantly, I want to thank the SCAI staff. So Francesca Day has been absolutely provided stellar leadership. And this is an amazing and talented SCAI staff and incredibly hardworking in a very difficult year. So I want to give a clap and congratulations for our SCAI staff. But first, what I want to do is spend some time to really recognizing my special friend and colleague, Dr. Cindy Grimes. Cindy, it truly has been an extraordinary year, and congratulations, really. And she's not going anywhere. We'll have her around for a long time. But it's incredible what we accomplished this year. I admired Cindy before I even knew her. Cindy is one of those unique trailblazing people that come along once in a lifetime. She graduated from Ohio State and then did her fellowship at the University of Michigan. And for all those who know Ohio State and Michigan, that alone demonstrates her ability to overcome insurmountable obstacles. Throughout her remarkable career, she has been an innovator in so many areas of interventional cardiology, but clearly Cindy deserves tremendous credit for the development of primary PCI for ST elevation MI. Primary PCI remains the single most important advance, I think, in interventional cardiology and has dramatically changed the outcome of STEMI patients. It's important to note that Cindy actually started her career researching fibrolytic therapy. And I love this picture of Eric Topol. It's pretty crystal clear for me that Cindy is doing all the work. and so clearly, thrombolytic therapy was a step forward, but it was not without its drawbacks with incomplete reperfusion and hemorrhagic complications. So clearly we needed to do better. And among Cindy's major accomplishment was this New England Journal article in 1993 that demonstrated that primary PTCA was actually better than lytics with less hemorrhagic complications, really a major step forward. And this is actually a picture of Cindy that on a panel. This was, for those of you young out there that don't realize how controversial this was. This is Cindy being criticized on a panel, and I think she held her own. And clearly she pushed us forward. And I think because this is a slide that really every interventional cardiologist should know. This is the Keeley-Grimes publication in Lancet in 2003, which unequivocally demonstrated that primary PCI was better than thrombolytic therapy. And it didn't really end there. Cindy then showed, and I think another really major thing, step forward was AIR-PAMI, where she demonstrated that transfer of STEMI patients from non-PCI centers could be done successfully and better than giving fibrinolysis. And that was clearly important for me because that really led to, in our work to the development of regional STEMI systems. And we know now that primary PCI is the preferred mechanism of perfusion for not only patients at PCI hospitals, but really those transferred from long distance. And it's led to dramatic improvement. Really, we've changed the natural history of acute MI. As I got to know Cindy, I admired her even more. And we had the opportunity to travel around the world to develop systems of care for STEMI, as well as all acute cardiovascular emergencies. And we had a chance to ride camels together and almost got killed on our way to Taj Mahal. And this is here Cindy celebrating with other SCAI presidents. And I think this is the wonderful thing is Cindy's a real person. And she's a real person who has done so much to make this world better. So Cindy, thank you. It's been a marvelous year. I appreciate you and I appreciate all you've done for interventional cardiology. So for me, more than any other organization, SCAI represents not only interventional cardiologists, all the interventional cardiologists in the United States, but throughout the world. But more importantly, the millions of clinical and research staff that work in interventional cardiology, and probably even more important than that for me, and I think you'll hear a recurrent theme, is patients. And for me, this is personal. On the left side, you see a picture of my grandfather, Howard Henry, with JFK, and he died at a way too young, at the age of 63 in 1972 from a STEMI. And clearly, he would have survived today with our regional STEMI systems. But we still have challenges. And on my right is a picture of my father golfing in Ireland with my son shortly before he died of an out-of-hospital cardiac arrest. And I would tell you and challenge those people out there, we still have work to do because we need to conquer out-of-hospital cardiac arrest and cardiogenic shock. And we're doing that. And I think the SCAI classification has shown clearly that laid the groundwork to better design trials and shown the importance of cardiac arrest and how we do it. So I think now this is a time, it's never been a better time to make even more clear that interventional cardiology are stimulated by unmet needs. And that stimulates us to do innovation and discovery and translate that into knowledge that directly helps our patients. And I love this quote from Bill Gates. He said, humanity's greatest advances are not in the discoveries, but in how those discoveries are applied. And I think those of us who are interventional cardiologists, this is our job, not only in our local hospital, but in our region and throughout the world. So clearly, no year could have been more illustrated the need to be adapt and to address unmet needs than 2020 and 21. And it's hard to imagine a more disruptive year. And I want to say, I did not start 2020 as a COVID-19 expert. And the impact and disruption on interventional cardiologists was and remains unbelievably remarkable. And I am delighted to say that I think SCAI played a critical role in the rapid response to this crisis. We know that patients with cardiovascular disease are at increased mortality from COVID-19. We know that 15 to 25% of COVID patients admitted to the hospital have positive troponin. And we know that patients with COVID-19 with ST elevation represent a very challenging patient population that we'll talk about in a minute. But it became quickly apparent that there were unintended consequences of COVID as well. The decline in STEMI admissions, as well as all acute cardiovascular emergencies. And it was clear that this was related to patients' fear of coming to the hospital and resulted in an increase in out-of-hospital cardiac arrest and late complications of STEMI. It's like we went back 20 or 30 years. And so I was proud to say that SCAI rose to the occasion to address these challenges for our trainees, for our members, and again, most importantly, for our patients. And so these are, I think, just a small list of the things we did: surveys of interventional cardiology and cath lab directors, several surveys of patients that were very instructive in terms of how to change the course. The COVID-19 Resource Center was and still valuable. the guidelines, the initial ELM document, which came out really in March, followed by the acute myocardial infarction guidelines that were in both JACC and CCI. And I think for those of you out there, that was really made and focused by SCAI members. Shami was the first author and I was a senior author, but it was done in collaboration with the American College of Cardiology. And I think that collaboration has never been stronger. And of course, the NACMI registry and the Mechanical Circulatory Support Registry were brand new for SCAI to actually participate very quickly in registries. And there were many publications regarding the missing STEMIs and the late complications. And I think importantly, the Second Still Count campaign made a dramatic difference in actually bringing patients back to the hospital where they needed to be, to demonstrate to patients that the hospital is a safe place. And this was seen by hundreds of thousands of patients really all across the United States, and it made a tremendous difference. And I think that the NACMI registry, if you imagine, this started in March. Within 2 weeks, we had a protocol and a central IRB, and 70 sites did it with really a small amount of money that subsequently we have had some support. But these initial findings were just published last week in JACC, and I think we should all be very proud of that, because what we showed with COVID positive patients compared to PUI and propensity match, there's an increased frequency in Blacks, Hispanics, and diabetics, a very unusual propensity that we need to learn more about. COVID positive patients with SC elevation were more likely to present with cardiogenic shock, but not cardiac arrest, to have lower ejection fraction, to present with atypical symptoms, and more likely to present in the hospital. These patients were less likely to undergo an angiogram, but when they did undergo an angiogram, thankfully people were listening to the guidelines and the majority of them got PCI as recommended. But still, 20 to 25% of these patients had no clear culprit, which represents another really important area of investigations. And there was no differences in the culprit vessel or the door to balloon times. So clearly these patients had higher in-hospital mortality, about 32% compared to 12% PUI and 4% historically. So I think that this pandemic and our response demonstrated more than anything else why SCAI is important for you and why SCAI is important for a patient. So finally, what's next for SCAI in 2021 and 2022? And I think what we talked earlier about was that SCAI has worked hard to provide consistent, well-designed structure and with standard operating procedures to expand the number of people. And we now, with over 500 people participating in committees and councils. And I think Cindy in particular demonstrated the importance with the Diversity and Equity Inclusion Committee, the Women in Innovations Committee, the Early Leadership Mentorship, to name a few, as well as governmental relations and the SCAI PAC, have really never been stronger and played a key role. But I want to spend a couple of minutes talking about a new committee, which is the Scientific Outcome Committee. And our goal with this will be to advance science even more with SCAI-sponsored research. It'll be charged with the oversight of research activities, including scientific statements and guidelines, strategic surveys of SCAI members and patients, registries like NACMI and the Mechanical Circulatory Support Registry, as well as design of key clinical trials with industry and NIH. And finally, to provide clinical research training for our membership, in particular for fellows. So I'm excited about this. And demonstration of this has been really, if you look at last year, the 6 really important publications that were published in 2020 and the 4 that were published this year, I'm very proud to say that they are 100% incredibly valuable documents that really lay the guidelines for SCAI membership. So number 2, really important, is the strategic plan. And you've talked a little bit about it, but this will be obviously a key part of the next year. It really focuses on providing a home for interventional cardiologists, health policy, training and certification, advancing science and quality, and professional well-being. And this was very well thought out and worked with the SCAI staff and the board. And I want all of you that are listening out there to know that we want you involved in implementing the strategic plan. The third critically important thing that you heard about for the first time is the Journal of SCAI. I'm proud to announce and so excited, Alexander Lansky will be the first editor of this journal. This is going to take a lot of work, but we have amazing things in plan. And I think for the first time, SCAI will have its own journal, and that this took lots of thought and consideration, but we need all of you to participate and be part of that. And finally, for me, I'll return to normalcy. So our goal is to transition back to in-person meetings, as I told you, with the Fall Fellows, with SCAI 2022 and SCAI Shock next year. But we've learned a lot from virtual, and we plan to continue on virtual. So really this, I think, has the ability to expand the footprint of SCAI. So with that, well, I can tell you is I am absolutely delighted to have this opportunity to serve you. I'm here ready to listen. And so anybody who has comments, thoughts, input, and wants to be involved, let us know. And Cindy, my final thank you. We'll miss you, but you're not going anywhere. I'll turn it back to you, I think.
Okay, I think that was pretty incredible and embarrassing on my standpoint. I don't know where I can just imagine where you got all those slides, but those were never supposed to be publicly shown, especially the hot tub with all the presidents. No, but that's good. That's what I love about Tim and our family at SCAI. I mean, we work hard, but we play hard, and we develop these great lifetime relationships. So it's phenomenal. So thank you to everybody, and I'm so thrilled and honored to have been your president for this year, and looking forward to taking the job as immediate past president, where I can take a breath and calm down a little bit and watch Tim Henry do his thing. He's going to do an amazing job.
Yeah, I think the main part of that is hopefully it's been demonstrated. This is a team sport, and there's a tremendous amount of people involved in this organization. And, from the program committee, you saw the incredible program. And really, I don't think ever in my lifetime that the committees and councils have never been as strong, and that have really involved a tremendous amount of people that make this a better place. And I think that now our relationship with ACC, our relationship with the other professional societies is really strong, and people realize we represent interventional cardiology, and most importantly, interventional cardiology patients.
Mm-hmm. Right.
Congratulations, Cindy, and congrats, Tim. It's a fantastic past year and upcoming year to be.